This is a quick video to show you how to use the Microsoft Access database for the Teens Exploring Careers Camp. Microsoft Access is a little bit different navigation, so it's pretty important to kind of know some of the tricks and traps when it comes to Access. This is a great life skill to have. A lot of small businesses use Microsoft Access to create databases. Maybe nonprofits might use it to create a grants tracking database because you can put these great forms on the front and then nobody messes with your tables on the back, which is pretty nice. So for the Teens Exploring Careers database, the first one is patient admission. And we'll go through this screen real quick. You just click on patient admission and you notice there's a new here. And down here it says record 1 of 1. You will always see 1 of 1 on patient admission because it's set for new patients coming into the mock hospital. So some of these are required fields. And as you go through, you'll be able to determine which one it is. When you hit close, if it gives you an error, like required field, then you will know that you missed a required field. So if I put in test 2 and test 3 and test 3 here, and then I try to hit close, it says you must enter a value into middle name field. Okay, so I need the middle name. So I'm not going to close. Whoops, it's giving me an error. Don't worry about those errors. So I'm not going to close it. I'm just going to put something here. I'm going to pretend their date of birth is 06/01/1981. And then we're going to say they're single. And I'm going to go through and fill all of this out. And one of the things that's really important to do here is to make sure that you fill out as many fields as possible. So we're going to say 123 Main Street, and the city we're going to say is Powell, Wyoming. And you can put the zip in if you'd like, but I'm going to leave it and see if that changes. USA. And I'm not sure what the Powell zip is, so I'm just going to put the Laramie one in because I actually don't know what it is. We're going to put Wyoming 1, 2, 3, 5, 6, 7, 8. And we'll put Wyoming and the social security number 111223333. I'm just filling this in with all sorts of stuff. We're going to say Brian is the emergency contact, and we're going to say his last name is test 3, and we're going to say this is a spouse, and we'll say this person is Marie, so it's easier here. And then we'll say the emergency contact phone is 307-307-1111. And the admissions person will be getting a card for each person, and they have forms that each patient comes in that they'll have to fill out, and then they have to put this information in. And that's why it takes so long at a real hospital for admissions to go through. So we're going to say the primary care provider is Ms. Doctor, and the preferred pharmacy we'll say is Ridley's, and the pharmacy phone we'll say 307-123-4567 or 4568. Whoops, I messed that up. We'll just say 330. And then you'll also get insurance company information. So we'll say Blue Cross, Blue Shield. And we're going to say 1. And the billing address is going to be 123 Cheyenne Street. And we're going to say Cheyenne, Wyoming. And I think I remember Cheyenne is 82001. And none. Whoops. And then we're going to say yes, consent to treatment, patient rights, etc. Now, patients can have more than one insurance company. So it's possible that you might have to fill out the next record. Most of the time, I think the patients, we kept it pretty simple, and there's just one insurance company. So let's close the patient admission. Great. That took. Now, if you go back into patient admission, it still says 1 of 1 because you're entering new patients each time. And that's just kind of the background. And you can hit close if If you have not started a record, you can hit close without any errors. But you might get a micro error. Remember, this is an amateur database that we put together, so you might get a macro error, you might get an error that makes sense, but basically what it's going to mean in that admissions screen is that you forgot to fill something in, so make sure every field's filled in. Now, the next one is for the nurse that first sees the patient. So the patient goes to the admissions department, gets admitted, fills out all their forms, and then an ER nurse might take them back. And this is for the nurse. Now, notice there's records 1 of 7. You have to find the one that has Marie in it. So you put your field, notice that my cursor is right here over test. I'm going to hit search, and I'm going to search for Marie. Now, Access has kind of a funky little thing here. We want to look in the current field. So if you are not in the first name field when you're looking for that patient, you will not find them. It also wants to match the whole field. So change it to any part of field if you're just putting in like MAR for Marie. And so you have to search and find that patient. That's a funky little thing for Microsoft Access. And so notice that it comes up with Marie and test 3 and her date of birth. So we know we have the right person. This is why nurses often say, what's your full name and what's your date of birth? So the ER nurse should definitely do that. Then you take her height. We're going to say she's 5 foot, 2 inches. So you could say 5 foot, 2 inches. We're going to say her weight is 125. Registration date would be today's date. So you can just put whatever your today's date is. And the release date will come in later. You ask the patient why they were admitted. Do you have a broken arm? Does your arm hurt? Are you having chest pains? And we'll say chest pains here. And then you would fill the release date and the release instructions out after they've seen the doctor and once the doctor has actually provided their diagnosis. Now, the nurse has to take a few different background information for the patient. So maybe this patient is allergic to amoxicillin and maybe they're taking an elderberry herb. So ask the patient what drugs they're taking and what medications, what drugs they're allergic to and what medications they might be using. And then the patient diagnosis, this is for the doctor, but you may want to do family health conditions. Maybe they have a history of arthritis, and you might want to take some notes about that here. Maybe they get vaccinated for COVID or chickenpox or something like that. You can put in the date of the vaccine. I'll just put 01/01/2024, and because maybe they didn't get I'll just go in here and do it this way. We'll just say February 1st, 2025, because I didn't like what I was putting in. You might want to take pain, nurse monitoring. They might have some pain. So every 15 minutes, 20 minutes, 30 minutes, whatever you guys decide as a nursing group or a hospital, you may want to come in and add a record. So when I add this record in for the pain, when did the onset of the pain begin? Yesterday. As soon as I enter, notice that you could do another one later on, and you could enter the next one 15 or 20 minutes later if you'd like. And so you can come in and just enter notes here. This could also see, and notice that this one says nurse monitoring. Now, all of your packets will tell you which screens you're supposed to be going to as a nurse or a doctor or the admissions person or whatever. The nurse should also be taking vitals. So the blood pressure could be 125/70. Pulse rate could be, 56. Temperature, maybe they're running 103. Respiratory rate, all this. You actually have equipment in there that allows you to take these, and if not, make it up. But you need to come in and take these notes every 20 to 30 minutes, depending on, what you decide. And these might just be extra notes you want the doctor to see. So we'll just call this extra notes for the doctor, and you can type in whatever you'd like. Remember, you're playing the part of a nurse, and so you definitely want to ask relevant questions about their pain. If they're having chest pains and they live alone and you release them, do they have somebody they're going to stay with? That might be something good too. The next one is the patient treatment, and this is also the same screen. So you have to search for Marie again. And once you've searched, it keeps the any part of field. So it's easier after your first time, but I just wanted to show you. So the doctor's supposed to come in and look at this, find out what's going on. The doctor is supposed to put in the diagnosis date. The doctor is supposed to put in the treatment information here. What subjective observations they have, what objective, like their bones sticking out of their wrist. That is an objective observation. What the assessment is, what the plan is, what recommendations they have, what tests they're ordering. Maybe it's a head wound and they have to go get a CT scan of their head or an MRI of their head to see if there's any brain swelling or bleeding. So this is what they can do. We're going to say, since Marie came in with chest pains, I'm going to order an echocardiogram, and that's going to be 5/5/2025 or 5/6. Sorry, today's the 6th. And so you can see that has been ordered, and you would want to put in today's treatment date too. You may prescribe meds after you get some of the doctor might actually want to prescribe something for chest pain. Maybe they decide to do lisinopril for high blood pressure or Lipitor for cholesterol. So we'll say, okay, we're going to do that. And we're going to say it is by Ms. Doctor, and that would be your name if you're the ER doctor. And the date written would be today's date. Day supply, maybe you just do 30 and you do it with 6 refills because you want to see them in 6 months. Take 1 time a day, something like that. Now, if you need a drug that is not in this list, then that's when you call IT and ask them to put a drug in for you. The doctor is also in charge of looking at the test results. Part of those test results will be entered if the doctor ordered an echocardiogram, then radiology would be putting some of the test results in, sending them over to the doctor, and the doctor would be probably putting additional findings in here. So this is mostly for the radiologist, but there may be some doctor interaction. And then the doctor is supposed to enter with the nurse the release date and the release instructions. Okay, so that is the first 3 points. Now, let's say we have that Marie lives at home, her husband's overseas, maybe her husband's deployed. So we're going to search for Marie again, and we're going to find her and then hit cancel. And we're going to say, you know what, Marie's living alone. She's having chest pains. We don't think it's a heart attack today. Maybe it is, but let's pretend that we don't think it's a heart attack today. But we want somebody there because if she's living alone and she is having a heart attack and maybe some of the tests didn't come back or were inconclusive, but we still want to send her home because she'll sleep better. Maybe Marie needs to have a friend stay with her. And so, or maybe instead of Marie being admitted to the hospital, maybe she broke her hip and she needs to go to rehab and she needs to be in an assisted living center for rehab for a while. That's when you would bring the social worker in at a hospital. And so the social worker would use these to determine where is a safe release for this person who lives alone. And there's other reasons social workers are brought in. Sometimes they need help navigating the patient's process system or something like that. But this is where the social worker would add it in. And just the big thing is to keep checking to make sure you have that right patient, because the last thing you want to do is create a HIPAA violation and put somebody's patient notes on the wrong patient, because that could be $1 million fine. Now, the social worker can also click on this view patient information, and they can see that Marie test patient information and review this information, but they should not be able to change it. The social worker should only be able to look here. Now, we don't have this database locked down. So there could be many things here that you could change even if it's not in your role. So use the honor system Make the Teens Exploring Careers Camp fun and just try to stick to your lane as much as you can. Now, everybody needs to be billed before they leave. And so I'm going to search for Marie again. Oops, where is Marie? All right, let's see where. Now, see, here's the second one. I must have mistyped Marie or put something in there. So I'm just going to find Marie this way by going to 7. And it sure does look like Marie's not in here. So I don't know why Marie isn't in here, but it's odd because this should be Marie. And it's probably because I changed the name last minute. So I found a bug in our software. You might find one too. Adjust. It's typical even in a real hospital to find bugs in software. And so just adjust, don't worry about it. We know it's the same person. It's the same driver's license number, same social security number, same state. So that's what happened is when I hit that search, I had entered this and somewhere in our program, that first name got populated to the billing table because I typed it in wrong in the first place. So Marie has Blue Cross Blue Shield, and there's patient billing services. So we have to find out what service she had. So she had an ER doctor soap note. That was one. And she had a ER facility room fee. That's another. And she had a generic medication from the pharmacist. And maybe the pharmacist even came and visited her and talked to her about the lisinopril. And then maybe she did have a test or procedure, and she also had the radiologist interpretation. So these would all be things to add. And then you would go through and figure out from her insurance card, from Marie's insurance card, what percentage the insurance paid for. So maybe it paid for 100% of the ER doctor evaluation and the room fee. But the medications, maybe it only pays for 50%. And the radiology test, maybe it only pays for 80%. And same thing with the radiologist interpretation. I don't know. I'm making these numbers up, but it will be on the report card. You can go back in and look for social work services, see if any of those occurred. If so, you would add another billing line. And then you can also go back in and look at the patient treatment services and find out what exactly was performed, and then go ahead and put the billing in there. And then you hit run billing report. And you can see Marie is going to be billed $450, $500, $1,250, 600, $1,250 again, and $280. So her total bill today is $1,800 for what she owes. And you can print that out on the printer that's provided. Okay. We also have reports menu. This report can also give you the discharge report. So let's find Marie. And let's see, here she is. Here's Marie. We can get her discharge report, her admissions report, her test performed, procedures performed, and referrals report. And you can print those out as she's discharged. The discharge report will not have the information in it if the doctor doesn't actually go back into patient treatment and finding Marie again. And we can do that down here too, because we know it's the last record. And if the doctor or the nurse, ER nurse, did not put in the release date and the release instructions, then the discharge report will not actually have good information in it. But all of these could be created. And then again, if you're having trouble, talk to IT. They'll put in a ticket. Now, if you see a bug in the database, we would like a real ticket put in by IT so that we can actually work on it and make it better in the future. But remember, real databases have bugs too. Now, there's going to be a lot of administrative roles as well. So you want to go to this second menu. And if you go back to the main menu, it's go to administration menu. And this is just usage rights. That is our copyright. So you don't have to worry about that. But we have an HR role, a payroll role, a marketing role, IT and code maintenance. That's where the IT person is. Compliance. Hospital compliance is huge. Hopefully you've been talking about that in school. So what does the HR resource person do? Maybe they're over payroll, marketing, and IT management, and maybe they're doing a policy review. Here's a couple of examples of IT reviews in here that have already been input by previous campers and previous people using this database. It's important just to check in on marketing, check in on the payroll, check in on IT. Payroll is kind of difficult. But it's fun. I think you guys will have a great time with it. And you can see that there are 5 employees entered in payroll right here. We've got Jane Test, Julie Camper, you've got Brenna Test, you've got Nancy Test, and you've got Riley Test. And so you can see here the employee deductions, whether you have to fill out whether they're salary full-time, what their staff position is, which is this is their rate of pay. It comes in when you get their admissions, and then what their hours were and what their rate of pay is, and then the head of household, what their filing is for their W-2. This is all in your packet for the biller, so you're going to have to read that and think about it. We have had campers that played both the HR and the payroll at the same time, and look at the hourly rate here. So the radiology tech gets 35 bucks an hour, admission gets 19 an hour, and ER nurse gets 40 an hour. Billing gets 17 an hour, and Jane Test gets 19 an hour. Wait till you see some of the other hourly wages. When payroll goes out, quite often it creates a problem. To add a new camper, hit add paycheck. And when I say that it creates quite a problem, let's put this in. The disparity of pay at a hospital is very high, depending on what your role is. So we're going to say test, radiologist, and the staff status is going to be full-time, salaried. Staff position, we're going to say radiologist, and then the hours, we're going to say 160. And I think the rate for the radiologist, I can't remember the billing packet, but I think it was like something like 350 an hour. And then the staff filing is head of household, we'll say. And the health insurance, we're going to say family, head of household. And then you have to calculate the federal income tax. And there is a tax file there that is in your packet as the biller, and it's going to tell you how much to withhold. So I'm just going to guess and say we're going to withhold, I don't know, $10,000, something like that. And there we have it. So radiologists are they make a lot of money, but they also have to really learn how to do their job well, because people can be misdiagnosed with cancer. Then you hit run payroll report, and you hand out the paychecks to everybody, or the pay stubs to everyone, not paychecks. And we'll see what happens when people find out about the different rates of pay. It's interesting. Remember, HIPAA violations can happen, and so that will also be coming up in the compliance when we get to that. Now, what does marketing do? Marketing has 2 things. They might give a survey, okay, and this would where they would enter the survey results, and they might also decide to do a marketing or a cybersecurity awareness training that is required by department. And so marketing might do that. Now, marketing is a good role that you could combine with like billing, or you could combine it with compliance potentially. So marketing's got a pretty easy role. Compliance or IT, let's go to IT. These are how you would add a brand new code. So if you need a new diagnosis or a new drug, let's say you need a new drug, let's see, medications. You would go into medications. All you would have to do is add in the medication down here, and we're going to say prescription. So follow the same rules, and we're going to say it is metoprolol. And we're going to say that one is for heart disease. Okay. And now on medications, you can just close it right up here with the little X that doesn't have a closed screen because it's in an Excel spreadsheet type of format. Now I go back into medications, And it is here, metoprolol is here for heart disease. And they are supposed to alphabetically sort. Okay, so code maintenance is pretty good. You might have to add a new test. You might have to add a new test type, all sorts of things here, but this is what IT is doing, as well as IT will be responding to some emergencies that might occur that your teacher will announce. Final thing is compliance. This is, notice there's two records here. So there's a policy review and there is a physical walkthrough. There may be something else where you're preparing for an audit or a risk assessment, or maybe you have some staff training you need to do with the marketing person. Maybe you're doing a health records review. Compliance very well, like if a HIPAA violation or a pharmacy drug theft was reported, compliance very well might need a new task type here. And that would be when IT would say HIPAA violation needs to be added to this. So the compliance officer would need to grab IT and have a HIPAA violation added in there. And then maybe they would talk about how a HIPAA violation occurred because somebody entered the wrong patient information on the wrong patient record. Or maybe two doctors or a nurse and a doctor were discussing a patient in a public area. Or maybe somebody came and stole the Skittles and and there was a drug theft. All of those things need to happen, but compliance should get with HR and do this policy review because the employee policies at this hospital are woefully out of date. And one of the things that you're definitely going to want to do is to do this policy review after the mock hospital is over and find out what types of things went wrong when payroll went out, what types of HIPAA violations occurred, what types of drug thefts occurred, how could things have been written down ahead of time so that this hospital would be ready for a problem, because HR might just be kind of in a world of hurt because they don't have any written statements about acceptable employee behavior in the case of an emergency or a HIPAA violation. Okay, so those are all the roles. I'm going to go back to the main menu. When you're completely finished with your Teens Exploring Careers experience, just exit the database down here where it says exit, and you should be good to go. Hopefully, this has helped you out with what the database looks like and how to use it. Thanks so much, and happy camping.